The Limpopo province has issued out a tender inviting bids for their renewable energy strategy action plan. And the aim really is to help the province reduce its reliance on Eskom. Although Limpopo, rich in coal deposits, is home to a new power station, that's Medupi. But it's now pinning its long-term energy supply in renewables. And our reporter, Moloko Moloto, is following the story and joins me now to give us this update. Maluma, good morning to you. A pleasure having you. But let's talk about the Limpopo province now issuing this tender. What exactly is the process and why are they inviting, some of the people and businesses rather to bid?
Good morning, Rahadi. Well, indeed, the province of Limpopo has issued out a tender essentially inviting those with interest to submit their bids in order to assist the province to move on to the renewable energy source. You said it is quite rich with an abundance of coal, yet there seemed to be a move towards renewable energy. The Premier mentioned this sometime in February during the State of the Province address, that they, as a province, needs to start at least helping to mitigate the effects of this rolling blackouts. Of course, with also a specific attention on the clinics, the hospitals, as well as the schools. Now, we don't know up to so far in terms of the specific details as to exactly how this is going to be rolled out, but we know this northernmost province is rich with a lot of sunshine. Assumption there is that possibly they will be moving towards solar energy source. And we know that you would recall that at the industrial park of the Makado Musina Special Economic Zone in the town of just outside the town of Louis Trichat, the Chinese company at some point had pledged to build a coal energy power plant there, but that particular plan has since flopped, because you would recall in 2021 the Chinese President Xi Jinping, when he was addressing the United Nations General Assembly, he said that China was going to stop funding coal-powered energy plants abroad, and it was no surprise when the intention to build that coal energy plant in Louis Trichat, I think it was the plan was that it must produce at least 1,000 megawatts. Now the province has now said we will still continue with a similar project, however, from a renewable point of view. Of course, what is happening, as you can see behind me, is that the province has also is going to be handing over they call it a technical handover of the site. This is where a new hospital, they say it's a central academic hospital, is going to be built in the coming months. Now the question is, if the hospitals and clinics, there currently are 43 hospitals in the province and about 400 clinics. Currently, they are being affected negatively by this rolling blackouts. How are they going to ensure that this new building that they are going to be constructing is going to be getting sufficient power? And of course, those are some of the questions that once they are done with this official program, we'll speak to the MEC of Health, and we'll also speak to the Premier to get to hear about this plan. How much money has been set aside? What are the timelines as well? And whether they believe this will take the Limpopo province perhaps out of the national grid. Is that the intention? Those are the questions that we will pose to both the MEC of Health as well as the Premier.
Yeah. But look, at this point, do we know of any challenges that are supposed hospitals, clinics out in Limpopo are, enduring due to load shedding? I mean, patients obviously having to depend on going to these clinics and hospitals for medical supplies, but also for medical health care. Have you heard of any, complaints, concerns whatsoever from healthcare members in terms of what they're currently going through?
Well, undoubtedly, load shedding is affecting the healthcare centers. The 482 clinics in the province and the 43 hospitals, they are bearing the brunt of this rolling blackouts. But as I was interacting with officials here, I'm told that actually they have bought more generators to ensure that at least they mitigate. However, those generators are not supposed to necessarily replace the constant supply of electricity. They must come in a form of an emergency. And the plan is that besides this grand plan that the Premier wants to introduce, the MEC has been instructed by the Premier that she needs in the short and medium term try to find mitigating measures to ensure that at least if it takes that she puts solar panels on the rooftops of hospitals and clinics, that ought to happen. The MEC was telling me, I think yesterday when I was just interacting with her telephonically, that they have already begun with an assessment to determine as to specific clinic or hospital in terms of the power that it would require from renewable energy. We will, of course, get to speak to her in a short while to understand specifically how much that will cost, because ultimately it boils down to issues of money. But to answer your question, yes, indeed, clinics and hospitals are being affected. Not only that, even the issue of water supply. When there is a load shedding, the water treatment plants are not able to operate to clean the water, but also to give pressure into the reticulation system for people to get water.
Yeah, and I suppose that's why many calls are being made for Minister of Public Enterprise Pravin Gordhan not to appeal that court, judgment that there should be an exemption to facilities such as that, clinics, hospitals, providing that very critical service, of course, to South Africans. But I'll leave it to you, colleague, for now. As soon as, of course, we get word from the MEC or when you're ready to get those answers from the MEC of Health, we'll be sure to catch up again with Moloko Moloto, authorized in the Limpopo province.